ऑस्टियोआर्थराइटिस में जब भी आपको प्रॉब्लम होता है, जब भी आपके कार्टिलेज इन्फ्लैम्ड होते, कार्टिलेज अफेक्ट होता है, तो इट इज नो नेसेसरी इन बोथ साइड यू आर अफेक्टेड. See, the major difference between rheumatoid arthritis and osteoarthritis is asymmetry. Asymmetry means क्या होता है कि अगर आपको लेफ्ट जॉइंट्स में प्रॉब्लम हो रहा है, तो इट इज नॉट कंपल्शन कि आपको राइट जॉइंट में भी प्रॉब्लम हो. अगर लेफ्ट शोल्डर में स्टिफनेस है, तो जरूरी नहीं है कि आपके राइट शोल्डर में भी स्टिफनेस हो. इट इज ऑन द सिंगल साइड ओनली. In some cases on the both sides, both knees generally, but generally osteoarthritis occurs in single side only. That is the major difference between osteo and rheumatoid arthritis, right? Now you understood the symptoms. Let's see how you diagnose the problem. Because if you diagnose the problem properly, then only you can treat the problem. How you diagnosed? Basically, to diagnose the problem, symptoms are the most important factor. Once you understood the symptoms, then your doctor will go for some physical examination. Physical examination, like they can physically check, like what about your movement? You can move your fingers, you can move your knee joints, so that they'll come to know about the tenderness and the stiffness and the swelling around the cartilage also. Physical examination may include your routine movement, normal walk, so that the doctor can observe the steps, because sometimes the gait, we can see the physical examination, the best word in scientific term is gait. Gait observation is the best observation by doctors. Over there what happened, the patient's whole body, the movement of their steps, the structure, specifically the neck area, the back area. So the movement, while doing the movement, doctor will diagnose the difference between the movements. Rather, the movements are normal, the body turns little bit on left or right side, the posture of the structure is perfect or not. At the same time, while physical examination, they can also check the normal position of your body and the cross position of your body. So different type of physical examination is there. Some type of x-rays are also there to diagnose the osteoarthritis. Along with that, the main important over here is the MRI. To diagnose the osteoarthritis, MRI is really very much helpful, because MRI will show you the deep tissue images. With the help, one can diagnose how the damage occurs, at what level the damage occurs, right? There are actually no blood test to diagnose the osteoarthritis, but of course nowadays we can see the osteoarthritis is like along with that so many lifestyle problems are there. So to understand, rather the patient is suffering from any diabetes mellitus or any other disease, the cholesterol level is there. Now let's see, after diagnosis, who are on the risk factor, the person more prone to face this problem. First of all, the risk factor is age. As you grow older, you are more prone to face the problem, because nowadays our lifestyle, food, exercise, the body movement is restricted. It's not on a proper way. So age is the main risk factor. Generally it is seen over an average after the menopausal age, or you can say in women's after the 50s, or in men's it must be after the 60s. Generally it is seen that they are more prone to face the osteoarthritis problem. Second thing, sex. So compared to the men, women are more prone to face this problem. Predominantly women are facing the osteoarthritis problem more. There are 2 or 3 specific reasons as we can conclude. The first of all, after the menopause, when estrogen and progesterone levels are decreased due to the menopause, the deficiency of calcium increases, the deficiency of vitamin D3 is increases. So these changes are happening in the human structure, right? So due to that, there is a chance to occur the osteoarthritis. Second thing, their diet. Generally, on an average, if I talk about the Indian women, nutrition point of view, they are very careless. That is again the problem. The profession I just told you, like those who are a teacher or the sales girl. Weight, extra burden on your joints definitely affect the problem. So the obese people are more prone to face the osteoarthritis problem. हमारा जो स्ट्रक्चर है, एक सपोज 5 फीट 4 इंच का एक जो स्ट्रक्चर रहता है, तो उसका हम आइडियल वेट क्या कैलकुलेट करते हैं, बिटवीन 53 to 55 or 56 something in between, right, for a female, for a girl. So our joints are capable of that thing only. 4-5 kg more overweight is okay, but when you cross the 60s and 70 kgs, definitely joints पे burden बढ़ जाएगा. Lifestyle. Lifestyle includes your food habits, your sleeping pattern, your physical exercise, your daily movement of the body, your psychological status also, your sleeping pattern and rest time also. Everything includes in lifestyle. And we all know, day by day, lifestyle related problems are increasing. Specifically, हम टाइम पे खाना खाना भूल जाते हैं, पानी पीना भूल जाते हैं. Exposure to sun, the major problem arises the osteoarthritis में exposure to sun. क्योंकि विटामिन डी बोन्स के लिए क्या जरूरी है, विटामिन डी एंड कैल्शियम, फॉस्फोरस एंड मिनरल्स, जो हमें डायरेक्टली नेचुरल सन रेज में मिलता है. स्पेसिफिकली इन इंडियन एंड द एशियन रीजन it is freely available. But still, nowadays you can see diagnosed with vitamin D3 deficiency. 1 in every 5 is a common ratio, you can say. So, exposure to sun is becoming less, and that creates the problem of osteoarthritis also. Before that, we used to cook our own food, and while cooking the food, lots of sweatings are there. मेहनत लगती थी. तो क्या होता था, टॉक्सिन्स अपने आप निकल जाते हैं. एक्चुअली यू नो, जब हम अपने इंडियन कल्चर में देखते हैं, हम रोटी बेलते हैं, दैट इज द टाइप ऑफ एक्सरसाइज. द होल हैंड अलोंग विथ योर फिंगर्स, दे विल गेट इजीली एक्सरसाइज. अगर 4 या 5 आदमी का एक फैमिली रहता है, तो कम से कम 25-30 रोटियां तो बनानी पड़ती है. दैट मींस अराउंड हाफ एन आवर तक हम रोटीज बनाते हैं, राइट. एंड दैट इज आल्सो नॉन स्टॉप. द रीजन गैस चालू है, फटाफट बनाना रहता है, राइट. तो आधा घंटे की तो आपकी नॉर्मल सुबह शाम की एक्सरसाइज होती ही थी. Now what happened? So many gadgets are there. Most of the time हम outside food खा लेते हैं, ऑनलाइन ऑर्डर हो जाता है. हमारे फूड पैटर्न्स चेंज हो गए, जहाँ पे हमारा ट्रेडिशन फूड कट हो गया है. 10 cuisines 12 cuisines फूड हम लोग खा रहे हैं आजकल, which are easily available. So this is something we can add in your lifestyle changes. This also affects in early osteoporosis. Genetics is another risk factor. You can say only, as per the research, only 2% is counted in genetically problem. Genetics means those parents are already facing the problem from the early age. The next generation is more prone to face. You can say only 2%. Rest risk factors we can easily manage. We can change lifestyle. We can add proper nutrition in our food. We can have lots of sunlights. You know. The weight we can easily control. This is all in our hand except the genetic problem. So these are some risk factors. If you are in this category, be alert, do some test and diagnose yourself early so that you can treat yourself